GHITA say there is only one audiologist in the health centre, leaving many people who have hearing difficulties without adequate care. Co-founder and trustee, Edgar Triai, explains the reasons behind the charity.
So me and others, especially after our deaf awareness, they came to see that there were a lot of people suffering from deafness and tinnitus and other hearing impairments, that they were a bit lost. And there are no protocols or proper advice from the existing GHA channels that would help them 100%. There's no rehabilitation officer, for argument's sake. So all these deficiencies we want to complement and improve on the existing services. I don't want to discourage the hard work involved of Tony Lodo, who is the GHA audiologist, but unfortunately in the UK and in Spain, and the audiology department is composed of a team of people. At the moment it's just him, and it's been just him for 35 years. To be honest, I know of many members of the general public who have come through the net and not actually have proper diagnosis and proper treatment and proper support for their hearing.
The association invited a representative from UK charity, the Hertfordshire Hearing Advice Service, to teach volunteers about hearing aids so they can ease pressure on the hearing department, enabling the doctor to focus on more serious matters. Gary Appleby expressed shock at the lack of provision for the people with hearing difficulties here in Gibraltar.
At home in the UK, I can go to a doctor, go to NHS, get my hearing aid. Fabulous. The journey here seems to be fraught with time constraint, funding, and it does seem to me that hearing impairment has very much become a poor relation in terms of disability. The quality of life with people with hearing impairment in Gibraltar is dwindling because of that lack of provision. Access to services, access to follow-on services, the help that Edgar and his colleagues can give people really needs to be improved.
And what do you think about the work the volunteers are doing here today?
These volunteers have come in today. They want to get involved in the community. They want to see people benefit from their services. A lot of people who get hearing aids are elderly. They might have failing vision. They might have joint mobility. They can't, for those reasons, and that's only a couple of them really, maintain their own hearing aids. If these guys go through this training and they're able to do the very basic things with hearing aid maintenance, it maintains a much higher quality of life for all of those using hearing aids.
GHITA also hopes to gain premises where they can work from, something they say they've been campaigning for since 2008. They believe this would allow for the safe upkeep of records and equipment, whilst also enabling them to offer a more professional service to those with hearing difficulties in the community.
Okay.